You are about to watch a patient safety film created at Children's Hospital Boston in collaboration with the Risk Management Foundation. The scenario you will see has been scripted. The clinicians are real and work at Children's Hospital Boston. The family members portrayed are volunteer actors. The scenario follows a patient through the emergency room. However, the focus and the intent of the film is not the actual trauma, but to demonstrate best practices of several national patient safety goals. The film opens with Dr. Mandel, President and CEO of the hospital, demonstrating SBAR, a communication technique which stands for Situation, Background, Assessment, and Recommendation.
Situation. Children's Hospital Boston wants to be a leader in patient safety. Background. We've implemented all of the national patient safety goals and we need to achieve 100% compliance. Assessment. Not everyone understands how to implement all of the goals into practice. Recommendation. We've created a film to demonstrate best practices for all of you to watch and learn for how to achieve this goal.
The scene opens in Children's Hospital Boston Emergency Department with a trauma notification alert.
Children's Hospital, this is CMED calling. Do you copy?
This is Children's. Go ahead.
Children's, we are approaching our facility with an unrestrained 14-year-old female front passenger who struck a tree when the car she was in skidded off the road at a high rate of speed. There was a driver fatality. The patient walked away and was sitting on the side of the road when we arrived. Her vital signs are stable, but she complains of left-sided chest pain and some bruising of her lower ribs. We have her on a high-flow O2 with 2 large bore IVs in place, and she's in full spinal immobilization. Children's, we are 5 minutes out. Any questions?
No questions. We'll see you in the trauma room.
A 14-year-old no seatbelt. Let's call a trauma staff. I'll activate the trauma team. I can put them in room 33.
Perfect. Let's do it.
A 14-year-old patient is whirled into the trauma room by the paramedics. She is fully immobilized on a stretcher with a non-rebreather mask. The adolescent appears shaken up from the experience. The frantic parents arrive minutes after. While the trauma team begins to stabilize the patient, you will observe a demonstration of patient identification as the administrative assistant obtains intake information. Patient identification includes verification of 2 identifiers such as name and date of birth using active communication. An example of active communication would be, how do you spell your name, or what is your date of birth?
Hi, my name is Jennifer. Are you the parents and legal guardians?
Yes, we are.
I know you're concerned about your daughter, but the team is already taking care of her. I just need to get a little information from you, okay?
Sure.
Can you spell your daughter's last name for me, please?
Smith, S-M-I-T-H.
S-M-I-T-H?
Yes.
And her first name?
Emily, E-M-I-L-Y.
That's E-M-I-L-Y.
Yes.
Has she been here before?
No, Emily's been pretty healthy.
Okay. And can I get her date of birth?
June 28th, 1993.
So that's June 28th, 1993.
Yes.
Can you verify this information is correct?
That looks good.
Okay. The only other thing I need from you is if I could get your signature. I just need your consent for treatment today. Thank you very much. I'll be back later to get some registration information and complete the registration. I'm going to leave you with Anya, our social worker, okay?
Thanks.
All right, thank you.
Team members are present at the bedside caring for the patient and receiving report from the paramedic. Many things are happening simultaneously during a trauma, and we do not betray every aspect.
As you know, Emily is a 14-year-old unrestrained front seat passenger on a high-speed NBC car into tree. The bags are positively deployed. The other passengers med-flighted to area hospitals. She was found sitting on the side of the road, alert and oriented, complained of some chest pain. She was tachy to about 120, otherwise her vital signs are stable. Are there any questions?
Did you say she was a front seat passenger?
Yeah.
All right, thank you.
Great. No questions. Thank you very much. Shannon, let's make sure we check to see if she has anything.
Healthcare-associated pathogens are most often transmitted from patient to patient on the hands of the healthcare worker. Cleaning your hands before and after patient contact is one of the most important measures for preventing the spread of microorganisms in the healthcare setting. Wear clean gloves when touching blood, body fluids, secretions, excretions, non-intact skin, and mucous membranes. Performing invasive procedures, including venipuncture. Touching objects or surfaces contaminated with blood, body fluids, secretions, or excretions. Change gloves and treat hands during patient care if moving from a contaminated body site to a clean body site on the same patient. Remove gloves promptly after use. Perform hand hygiene immediately after removing gloves to avoid transfer of organisms. The following scene repeats patient identification with new members of the healthcare team.
Hi, my name is Anne. I'm going to be your nurse today. Are you okay?
I guess so.
I heard you were in a car accident. That must have been really scary.
Yeah, by the looks of the car, I think I'm lucky to be alive. But do you know if my friends are okay?
I heard they were taken to other hospitals, but the social worker will give us more information on that soon.
Thanks, I'm really worried about them.
I know, but first we're going to make sure that you're okay. First thing I'm going to do is verify all the information I have is accurate. Can you spell your name for me, please?
E-M-I-L-Y-S-M-I-T-H.
And your date of birth?
June 28th,
And the year?
1993.
Great, thank you. This is Wally. He's going to help me get your vital signs, okay?
Hi, Emily. My name is Wally. I'm one of the clinical assistants here in the ED. I'm going to take your blood pressure, put some stickers on your chest, and hook you up to the monitor, okay?
Okay.
The doctors have completed their primary assessment of the patient and have determined that she has decreased breath sounds on the left side and are preparing for some tests to confirm. Improving communication among caregivers is another Joint Commission National Patient Safety goal. Miscommunication is the #1 cause of healthcare errors. The nurse utilizes the read-back-feedback method to close the loop of communication with the physician before carrying out the verbal order she received.
And let's get a CBC, a type and cross, and an HCG. And can you call for a portable chest X-ray?
Okay, I'll get a CBC, type and cross, HCG, and I'll call X-ray for a portable chest.
Right. Thanks.
The nurse is performing patient identification as she labels the specimens in the presence of the patient. She holds the label tube against the name band and notes a discrepancy. The nurse re-verifies the date of birth with the family.
Can you tell me Emily's date of birth again?
June 28, 1993.
1993?
Yes.
Okay, just one more. Francine? We have the wrong set of patient labels. It's the wrong date of birth. Can you give me another set?
I'll work on that.
Medication reconciliation is another important national patient safety goal. 7,000 deaths occur annually due to medical reconciliation errors. A list of all medications highly visible in the patient's medical records include essential information about dosage, schedule, and allergies. Medication reconciliation should be done at every transition of care in which new medications are prescribed, administered, or existing orders are rewritten. In this situation, the pharmacist is obtaining a complete list of the patient's current medications.